Dolores, thank you so much for joining us today. The source now turns its attention to an alarming situation in the Niagara region, the opioid crisis. Glen Walker joins us now from Positive Living Niagara. Glen, welcome to the program.
Thank you. Nice to
Glen,
be here.
it really is a crisis. The numbers are staggering. Can we go over some of those numbers? The number of calls to EMS, the number of deaths expected once all the smoke clears, I guess, from 2020. What are those numbers looking like?
Well, I think what we're seeing in 2020 was 193 people died from overdose here in Niagara. That's up from 116 the year before, and just over 80 the year before that. We just keep seeing this continuous escalation of deaths here in Niagara. And we really have an epidemic within a pandemic here in Niagara at this point in time.
Is the pandemic part of what is driving those numbers up?
Oh, yeah, absolutely. We are seeing a change. In particular, what the coroner has found is that there's a significant number of people who have died who were alone. And during this phase of the pandemic here in Niagara, 38% of the people who've died, it's reported that there was nobody else in the home with them. Prior to the epidemic, it was like 15%. So the whole vision of stay at home, don't see anybody, has been really counterproductive to the opioid crisis, and it's really actually caused deaths with that sort of concept out there. Because we always talk about people using and having somebody with you to administer naloxone, and you can't administer naloxone by yourself if you're on the floor not breathing.
And that's very important. And although we don't promote drug use, people
Mhm.
are going to use those drugs. And when they do, it's important that they do it correctly.
Yeah, absolutely. Here in Niagara, there's thousands of people who use substances, and there are a million reasons why people end up with the addiction. But those addictions are very powerful. They're hard to get rid of, and people have to basically, in many instances, just maintain themselves with these substances just to sort of get by day to day. But the risks are so high. There's no control over these drugs at all, and so many people, even people who've been using for years and years, are overdosing.
More than 600 EMS calls answering to opioid overdoses. That's up from, well, it's up 126 from the previous year. That's
That's right.
staggering.
It's a huge increase. And what we're hearing from EMS and from the police as well is people are waiting longer even to call EMS. So when they arrive, people are in a worse state with that overdose. So we really have to address this whole issue of stigma. When someone goes down, you've got to call 911. No matter what, you want to do that. You also want to have an naloxone kit available. Last year, over 1,200 naloxone kits were used just from our program that's distributing these supplies. So that's potentially 1,200 people who may have passed away if they didn't have one of these kits.
Positive Living Niagara is one of many agencies involved in something called OPEN, and that's the agencies coming together to try and face this crisis head on. How are these agencies working together?
Well, it's a fantastic group that's come together. There's over 30 or 30 plus members within the overdose prevention education network of Niagara. And what we try to do is really share resources. If we have outreach workers working together, going to encampments, we have staff from the addictions counseling agencies, treatment agencies coming here to Positive Living where people are picking up supplies and actually doing direct service with them right here, right there. So we are seeing phenomenal collaboration and cooperation here in the region around the services that we've got. We're really improving access into services very quickly with kind of warm transfers where someone says, I have a need, and we were able to get them there pretty quickly. So we're just seeing some excellent work going on here within the Overdose Prevention Education Network. And we also have developed an internal alert system. So when we see a number of different substances coming and people overdosing, we sort of alert each other that something's going on and tell our clients about this so that they can take precautions out there in community. So it's this network has really gelled here in Niagara, and we've developed as well a substance use strategy, and we're just going to be rolling that out in the next few months as well. So I think we're very lucky in Niagara to have so many agencies willing to collaborate and cooperate here.
Do you feel that all these agencies have to be more proactive during the pandemic because people don't know whether they can turn to you, whether your offices are open, and if they're not open, how to contact you?
Well, exactly. And this has been a challenge, particularly with some agencies sort of crawling back their services and saying, well, we're going to do online. So many of the clients that we have here at Positive Living, for example, don't have internet service, can't do online. So what we end up doing with a lot of folks is kind of staying in touch, keeping connected with them while we're waiting for services to open up or for restrictions in the pandemic to be lightened. So fortunately for us, we've been able to maintain most of our outreach services during the pandemic. And that's really helped us so that when an organization says, yeah, we're back, we're open, we can connect people right away. And they've developed some excellent online and by phone services as well.
Glenn, thank you so much for joining us today. Let's hope we see those numbers go down in 2021.
Absolutely. Thanks so much for your help.